Welcome back to the Now Morning Show, 25 minutes to the hour of 7 o'clock. And our next conversation is about animals, because non-veterinary persons attending to animals continue to be an issue within Trinidad and Tobago. These imposters can do more harm than good to your animals, as well as the Veterinary Society. So joining us this morning is the president of Trinidad and Tobago Veterinary Services and founder of Tobago Animal Hospital, Dr. Paul Crooks. Good morning, Dr. Crooks, and welcome.
Good morning. Thank you for having me.
It's a pleasure to have you with us on the show this morning for such a different type of conversation, because to be fair, and as a pet owner, as many who are watching as well, honestly, this is the last thing that tends to cross your mind. But it seems as though this is posing a serious problem. So can you share with us this morning how prevalent this issue is throughout the nation?
Well, it's very difficult to give firm numbers or data. We know that it is an extremely common problem. We've had non-vets, veterinary impersonators, persons who are not registered to perform veterinary medicine, persons who are not qualified to perform veterinary medicine, have been administering injections, giving antibacterial drugs. They've been giving hormonal injections, and we've had persons performing surgery, persons who are not qualified. Of course, we have also had the consequences of such decisions and choices. And on the whole, what we're trying to encourage people to do is to find out who the legitimate vets are. I can even give out my phone number. It's 383-4451. If people are in doubt about the qualifications or the registration status of an individual, absolutely just message me and say, is this person a vet? Because here's what we're dealing with. We're dealing with patients who are being spayed, and in those instances, the dogs and cats may be just administered sedatives, and the animals may be aware and even awake while surgery is being performed. So we're talking about torture and cruelty. We're talking about cases where animals are being given vaccines while they are sick, which is not only not providing any benefit, but potentially could make the animals sicker. So we have instances where because persons are not qualified and because persons are not trained, you are ending up with animals that are really suffering. And in many instances, owners are aware that these persons who are doing these practices are not vets, and they still choose to go by them to save money or to avoid the hassle, what they may see as the hassle of going to the pet store and then going to the vet, for example. So we are encouraging persons, please, if you are in doubt, message me directly, 383-4451, and ask me, is this person a vet? And I will find out for you if I don't know the name myself.
Dr. Crooks, it's frightening to actually think of some of the things that you've just shared and some of the pain that these animals will go through, as well as their owners as well. So what can pet owners look out for in order to differentiate between a legitimate and a fake vet? Are there any particular signs that you could share with us this morning?
Absolutely. So first of all, vets will communicate. And if you go by a non-vet or an unqualified person, that person is likely going to just give shots. And that idea of giving shots, whatever that means, that's what will happen. You'll have someone who's just administering injections without explanation. You'll have someone who is not diagnosing. You'll have someone who is not giving you an idea of prognosis. How is this animal going to progress from this stage to what stage to what stage? So all of that communication is important, but also a veterinarian should be able to show you his or her qualifications. It is perfectly okay to ask a veterinarian to produce some qualifications, produce some credentials, show that the person is. Our members, the Trinidad and Tobago Vet Association, are all registered and all qualified to practice, and they carry with them cards to show that they are members. Of course, right now in Trinidad and Tobago, it is not the law that every qualified and registered veterinarian is a member of the Trinidad and Tobago Vet Association, but we hope that that will change in a few years to come. However, at this point, at least our members can show a card proving that they are veterinarians, but even if they are not members, persons should be able to produce their degrees, their diplomas, their registration status, and so on. And absolutely, you should ask. And if the person fails to produce that, it doesn't mean that the person isn't a vet. Again, message, because it may be difficult to tell if all your experience with a vet has been a pet store owner the entire time. It may be difficult to tell, and because you may have built a rapport and trust with this person, you may be in disbelief that this person isn't a vet.
Definitely. Now, Dr. Crooks, you just mentioned the association. Now, in addition to the association, are there any other perhaps regulatory bodies or organizations that people can go to in order to report a vet impersonator?
Absolutely. So first of all, I would say you can report to us for sure, but there is a veterinary surgeons registration board, and that board is responsible for registering all practitioners in Trinidad and Tobago. In fact, if a person is practicing veterinary medicine and not registered with the board, that is illegal. But the problem is that we haven't been able to gather clear evidence. People know that this is a non-vet performing surgery or non-vet doing vaccines, and nobody makes the reports because it's convenient and everyone uses these persons.
So aside from those challenges that you just shared, are there any other challenges that in particular are being faced in Trinidad and Tobago right now by the veterinary fraternity when it comes to having them stopped? Do you have that collaboration, let's say, from law enforcement, other organizations, and so forth?
Well, we are working on that at this point, and that is where our issue comes, because it's not just the vet association. Of course, you have persons who are posing as pharmacists, you have persons who are posing as dentists. And while it is not just a unique problem to vet medicine, because the consequences that we're seeing are patients actually dying. We're seeing animals suffering, bleeding to death. We're seeing patients that are dying because of severe infection as a result of mishandling of a disease condition, a treatment of a disease condition. We are seeing that animals are getting their ears cut and really butchered under sedation only, where the animals are conscious and aware. So when you put all of these things together, as I would say, by far the most suffering, whether or not you equate it to animal health, to human health, and you shouldn't, but the most suffering that we see is in the vet fraternity. Among some other issues that we have, besides the fraud that these persons commit, we do have issues with pricing and so on, where because these persons are undercharging, veterinarians are having a hard time making the appropriate sum of money to keep their business functional and operational. And that's one of the issues that we're dealing with as well. If persons are charging $50 to vaccinate a dog, and that's simply not a sustainable price, there's no way a vet can compete with that.
Agreed. Dr. Crooks, before we wrap this conversation, can you just share your telephone contacts with us again for those who may be interested in reporting?
Absolutely. So if you're interested in reporting a non-vet having performed surgery, and we really want you to be a witness, we want you to sign a statement and make it clear that this thing happened, you observed this situation, and you provide whatever documentary evidence you have, and I will guide you along that path. But my phone number is 383-4451. You can WhatsApp me, I will reply.
Wonderful. Dr. Crooks, thank you so much for joining us this morning on the Now Morning Show, and hoping that soon we'll be able to combat this issue.
Thank you very much.
Dr. Paul Crooks talking about vet imposters in our nation. There's a lot more coming up on the Now Morning Show, so don't go anywhere.